Good afternoon, my name is Graham Moore. I'm Professor of Social Sciences and Public Health in Cardiff University. Today I'm going to be talking about young people's use of e-cigarettes. So I'll give a brief history of e-cigarettes and their regulation. I'll talk about recent trends in young people's use of e-cigarettes. One thing I'll talk about in particular is the rise of disposable e-cigarettes, which has driven some of the trends that we've been seeing over the course of the last couple of years. I'll also talk about some potential future directions for reducing young people's use of e-cigarettes. So first of all, just a quick disclaimer, because I know this is a very contentious area. So I've never received funding or other support from the tobacco or e-cigarette industries and wouldn't accept it if it was offered. The research I have done in this area has been funded by the National Institute for Health Research and by Cancer Research UK. And this is a really contentious area where lots of different views are held, and we often see that position statements internationally often cite the same evidence but end up making slightly different judgments on what these mean for policy and practice. So the views expressed in this presentation are my own, based on my own research and colleagues' research, and don't necessarily represent the views of my funders, Decipher, Schern, or our partners. So first of all, just what are we talking about when we say e-cigarettes? These are battery-powered devices which are used to inhale vapour, which often contains nicotine, not always, but in most cases. Now, early e-cigarettes were designed to look a lot like cigarettes, often referred to as kind of cigar-likes. Pen-based e-cigarettes began to emerge a few years later. Then tank-style e-cigarettes became increasingly popular from around 2011. In the last 2 or 3 years, we've seen a big rise in disposable e-cigarette use. And I haven't included a picture of these because I wasn't able to find one that didn't demand a link to advertising be included within its use. So I haven't included that. But I'm sure you're all familiar with what those look like. So the first commercially sold e-cigarettes were invented in China around 2003, and they began to enter markets in Europe and across the US from around 2006, 2007. They weren't used very much in the first few years of their availability in UK markets, but their use by smokers and ex-smokers began to grow from around 2010. So this graph on the right is from the Smoking Toolkit study in England, and they first began asking questions about e-cigarette use around April 2011. And at that point in time, only a quite small percentage of smokers or ex-smokers were using e-cigarettes. That grew quite rapidly over the course of the next 2 or 3 years, then remained quite stable until around 2020, where we started to see growth again. When they first entered UK markets, there was little kind of specific regulation for e-cigarettes. So there was regulation which would apply to all consumer products, but very little specific regulation for these particular products. The age of sales legislation was introduced in Wales in 2015 and also in England. I believe that this was slightly later coming in Scotland for various reasons. But this banned the sale of e-cigarettes or the proxy purchase of e-cigarettes for any person below the age of 18, bringing them in line with tobacco cigarettes. Probably the most comprehensive set of regulations for e-cigarettes to date came as part of the Tobacco Products Directive regulations, which were introduced in 2016. This was EU legislation which banned cross-border advertising of e-cigarettes, so including things like TV and radio advertising. Introduced mandatory warnings regarding the addictiveness of nicotine across around 30% of the packets for e-cigarettes. It also limited the strength of products which could be sold as kind of consumer products, and mandated that any new products needed to be declared to the MHRA 6 months before their release. By contrast to tobacco, which can only really have negative consequences for public health, there is some debate around whether e-cigarettes are likely to be a beneficial product for improving public health, or are likely to create new risks where risks didn't exist previously. And over the course of the last 10 years or so, substantial, really robust evidence has accumulated that e-cigarettes can be really beneficial as smoking cessation aids. So there's some indication that they actually appear to be more effective than traditional nicotine replacement therapies. And they have become one of the most commonly used cessation tools across the UK for those kind of choosing to go it alone rather than using NHS services, for example. So they do potentially have an important role in harm reduction. And e-cigarettes are unlikely to be completely harmless. I don't think anyone expects them to be completely harmless. But they're also very unlikely to ever come even close to the harms of tobacco cigarettes. So tobacco cigarettes are often described as being the only consumer product which, if used as directed by the manufacturers, will kill 50% of their long-term users. So even though they're not risk-free, for smokers, switching to e-cigarettes is likely to improve their health. But I think even if we accept that there is a role for e-cigarettes in reducing harm by helping smokers to quit, it is an important public health message that if you don't already smoke, it's best not to vape either. So it's important that we prevent the use of e-cigarettes amongst non-smokers, particularly young people. I mean, amongst non-smokers, they don't represent a less harmful substitute. They represent a new harm where harm wasn't previously occurring. So young people's use of e-cigarettes has been a growing area of concern in recent years. I think actually sometimes the literature has tended to slightly caricature positions and to kind of frame people as either e-cigarette advocates or as kind of worrying about the impact of e-cigarettes for young people. I think actually many people do both simultaneously. Both argue that e-cigarettes can be an important product for helping smokers to quit, but it's really important to make sure that non-smokers aren't using them. Now, I mentioned that in the UK we didn't really start measuring adults' use of e-cigarettes until around 2011. So the first surveys to include measures of young people's use of e-cigarettes were undertaken in Wales and Scotland in 2013, and they began to be introduced into surveys in England from 2014 onwards. And what these tended to show was that experimentation with e-cigarettes was becoming quite common. Lots of young people were saying that they've used an e-cigarette once, but regular use was relatively rare and almost entirely confined to smokers and recent ex-smokers. Experimenting with e-cigarettes was kind of part of a cluster of behaviour, commonly overlapping with use of other substances, so things like novel psychoactive substances, smoking, drinking, cannabis use, for example. And young people's experimental use of e-cigarettes did continue to grow until around about the time of the new TPD regulations, when growth did begin to level off. Now, this is a graphic taken from our recent work evaluating the impact of Tobacco Product Directive regulations on young people's use of e-cigarettes, and we can see that experimental use of e-cigarettes grew quite rapidly from the beginning of the period we modelled, 2013, through to the kind of intervention point, so May 2016, when TPD regulations came into force. But after the implementation of that regulation, there was some evidence that e-cigarette use amongst young people was beginning to level off or even slightly decline. So it's hard to talk about young people's use of e-cigarettes without also putting that into context of trends in young people's smoking. And we know that young people's use of smoked tobacco peaked in the late 1990s, around about the time of the government white paper, Smoking Kills. And it's been declining steadily in the years ever since. So when back in the late 1980s, approximately 1 in 3 young people would leave school as smokers. That's now around 7 to 9%, so 1 in 11 to 1 to 14 in the most recent couple of surveys here in Wales. So still far too many, but far fewer than used to be the case 20 or 30 years ago. I think early in the emergence of e-cigarettes into UK markets, a big concern was that these might lead young people who wouldn't otherwise have smoked into smoking. They might act as a gateway into smoking. And related to this was the idea that seeing people using e-cigarettes because they looked a bit like smoking, so the growing visibility of a smoking-like behaviour would lead young people to think smoking is normal again. There have been lots of studies which show that children who try an e-cigarette are more likely to go on to smoke, but there are big question marks about whether that's causal. It's really hard to rule out kind of shared liability. So people who bungee jump are more likely to skydive. Does that mean that bungee jumping causes skydiving? Or does that mean that both of those activities attract similar people? But importantly, there is no evidence that smoking rates amongst young people have begun to increase again since the emergence of e-cigarettes. So we aren't seeing the progress that's been made in reducing young people's smoking being kind of reversed by e-cigarettes. So if there are any gateway effects, so if any young people who wouldn't otherwise have smoked are taking up smoking as a consequence of having tried an e-cigarette, those effects haven't been occurring on a scale that impacts kind of overall population trends. So in 2019 Shern data, we were starting to see evidence that e-cigarette use was beginning to level off or even decline. But new market innovations, including disposable e-cigarettes, which we mentioned earlier, have begun to kind of reignite growth in use of e-cigarettes amongst young people. The ASH survey showed that recently across Great Britain. And disposable e-cigarettes they're cheap, they're sold widely, there's lots of places where you can buy them. And some would argue they are marketed in ways that do appeal to young people. And what we're seeing in the 2021 Shern survey is that 20% of secondary school age young people are saying that they've ever used an e-cigarette, and that's similar to previous years. So no real growth in experimental use of e-cigarettes, but we have seen some growth in regular use of e-cigarettes, which grew from 3% in 2019 to 5% in 2021. It's important to note that in that time period, tobacco smoking has fallen for the first time in the last 10 years, with 7% of young people in year 11, the final year of school, leaving as smokers in 2021, compared to 9% in 2019. So we've seen that figure of 9% of year 11s being smokers remain the same from 2013, 2015, 2017 and 2019 surveys, and that's now fallen down to 7%. While Shern only collects data for a limited range of smoking and vaping variables, England does have a dedicated survey focused on smoking, drinking and drug use. And while there are differences across contexts, we do tend to see trends across UK nations mirroring one another quite closely. So the smoking, drinking and drug use survey in England showed no rise in experimental use of e-cigarettes from 2018 to 2021, but there was an increase in current use. Now their increase from 6 to 9% can't be directly compared to our increase from 3 to 5%, because our data focus on kind of regular smoking, by which we mean regular vaping, by which we mean using an e-cigarette weekly or more, whereas the English data combines kind of regular use and occasional use into a single figure, but shows a similar kind of proportionate estimates from 6% to 9%, so about a kind of 50% increase. But notably, the kind of percentage of users buying their own e-cigarettes from shops doubled within the smoking, drinking and drug use survey from about 29 to 57%, despite all of the participants in this survey being underage. So there are questions there about whether age of sales restrictions are being adequately enforced. I think one thing that's also of concern from this English survey is that the large percentage of young people, around a quarter, who are saying that we're purchasing e-cigarettes online. And it is likely that unregulated devices purchased online may become more dangerous than those sold in shops. So in 2019, there was an outbreak of e-cigarette vaping related lung injury. And this was kind of linked to vaping devices which included chemicals which aren't present in any devices which are legally sold on UK markets. So there is a concern that young people getting e-cigarettes from shops is problematic, because they shouldn't be able to buy e-cigarettes if they're under the age of 18. But there are also concerns about kind of potential illicit purchases online of devices which may be even more unsafe. So I've mentioned this quite strong suspicion that disposable e-cigarettes are driving the increases we're seeing in young people's use of e-cigarettes. We don't actually measure the type of e-cigarettes used within Shern, but this graph here is taken from the Great Britain-wide smoking toolkit study, and it shows the percentage of current vapers who are using disposable e-cigarettes by age. And it's a different survey because it looks at adults, so it's focused on people from age 18 up. But what we can see is a very clear age trend. So disposables have rapidly become the dominant product type for users who are of barely legal purchase age. So among 18-year-olds, disposables were the most commonly used e-cigarettes. That really wasn't the case for older e-cigarette users. So the green shaded box, which is my edition, shows trends during the course of the Shern survey. So we can see from the start to the end of the Shern survey, use of disposable e-cigarettes was increasing. And the blue shading shows the period beyond our 2021 Shern survey, where there's perhaps some evidence of slightly slower growth in young people's use of disposable e-cigarettes, but it continued to grow nevertheless. So it is likely that use has grown further since our most recent Shern survey. So in terms of how concerned we should be about young people's use of e-cigarettes, and this is one question I always get asked whenever I speak to the media about e-cigarettes, and e-cigarettes are unlikely to be even close to as harmful as tobacco smoking. So it's encouraging that smoking has begun to fall for the first time in 10 years. And some would argue that that's not entirely a coincidence. So this is a quote from the Tatton Birch paper that the graph on the last page was taken from. So the overall percentage of young people using any form of inhaled nicotine was stable over time, suggesting that in Great Britain, disposable e-cigarettes have mainly been attracted those who otherwise would be using other forms of e-cigarettes or would be using tobacco cigarettes, rather than attracting those who otherwise wouldn't be using any form of nicotine product. So there is kind of some potential evidence that young people who otherwise would be smoking cigarettes are instead using e-cigarettes. But ideally, we would be reducing the use of inhaled nicotine amongst young people rather than simply displacing it. So in terms of how we might think about preventing use of e-cigarettes by young people, I mean, there is some evidence from our work around the Tobacco Products Directive regulations that young people's use of e-cigarettes appears to be sensitive to regulations. Further regulation of e-cigarettes might include further enforcement of existing age of sale regulations. As we can see from some of the earlier slides, lots of young people are buying e-cigarettes even though they're not legally able to. There are kind of arguments for regulating the marketing and packaging of e-cigarette products to limit their appeal to young people. So TPD regulations regulated some forms of marketing, but not all. Specifically focusing on disposable vapes, ASH England have recently kind of argued quite strongly for introducing taxation for disposable e-cigarettes to make them less affordable than they currently are. They're currently much cheaper to use than any other form of vaping device, and the argument that ASH were putting forward is that we should look to tax them so that they're similarly expensive to other forms of vaping devices, but still cheaper than tobacco cigarettes. So you make them less accessible to young people, but still kind of maintain their relative advantage over tobacco cigarettes for smokers wishing to switch. And there are also potential kind of cases for kind of looking at where e-cigarettes can be sold. So we see disposable e-cigarettes sold in lots of places. They're very highly available. But for schools, I think the key public health message to get across is just if you don't smoke, don't vape either. There's little robust evidence that e-cigarettes do lead people to take up smoking and some evidence of displacement. But their likelihood of causing direct harms to adolescents is a cause for concern, even though they're unlikely ever to be shown to be as harmful as tobacco cigarettes. They aren't harmless devices. So e-cigarettes should be considered in health education and within school policy as part of a kind of spectrum of harmful kind of psychoactive products used by some young people, including tobacco, alcohol, high caffeine energy drinks. And these are clearly not all equal, but they're all likely to cause harm to developing adolescents. And they're all products which children and young people cannot legally buy, with the current exception of energy drinks, on which consultations are underway on kind of whether age of sale restrictions should be introduced. And they're products which young people certainly shouldn't be bringing to school. So just to conclude, I mean, e-cigarettes have a role to play in helping smokers to quit, but shouldn't be used by non-smokers. And very recent data do show a rapid rise in use of disposable e-cigarettes, particularly amongst younger users. So disposable e-cigarettes specifically really seem to appeal to young people. And some regulation is likely to be needed of these specific products to stem that growth. I think just one note of caution is we do need to pay attention to unintended consequences of regulation, such as kind of pushing young people back to smoking or toward the purchase of illicit devices online instead. And we do need to consider those things really carefully, alongside considering whether kind of changes in regulation do reduce young people's use of e-cigarettes.